Today we will be discussing the global health issue, pregnancy and anemia in developing countries. The devastating and preventable prevalence of iron deficiency anemia in mothers throughout the developing world is one of the top predictors of many maternal and infant health problems. The disparity between the developing world and industrialized nations is extreme and undeniable. What is anemia? Anemia is a health condition which results in a deficiency of red blood cells or hemoglobin in the blood. This results in a lack of energy as well as other medical complications. The most common deficiencies are iron, folic acid, vitamin B12, and vitamin C. A lack of one of these in the diet is the most common cause of anemia. Nutritional anemia is the largest problem in pregnant women due to the severe health consequences. Iron is a mineral that an individual can receive both via food or supplements. When a person does not get enough iron in his or her diet, they can become first iron deficient and then eventually anemic. During pregnancy, a woman has an increased need for iron. In every blood cell, each heme group contains an iron molecule. Iron is responsible for carrying oxygen from the lungs to the rest of the body. How does the lack of iron affect pregnancy? If the mother is iron deficient or anemic, her deficiency can lead to devastating effects on both the mother and child. At this critical time during a child's development in the womb, a decreased iron capacity has been shown to have a correlation with the following health issues for the child: preterm delivery, subsequent low birth weight, inferior neonatal health, lower iron stores for the child, lower infant APGAR stores, and possibly lower cognitive function. An individual can get iron in their food in common sources like beans, spinach, and animal sources such as meat. There are significant disparities between the developing world and the industrialized world. According to a study by the World Health Organization, a range from 35 to 75% of pregnant women in developing countries suffer from iron deficiency. This is drastically different compared to industrialized nations, with a prevalence rate of 18%. Iron deficiency anemia is also related to mortality rates. One study found that the mother mortality rate in Africa was 6.37%, Asia was 7.26%, and Latin America was 3%, all related to. Now, here is some data from studies in various developing countries. In Bangladesh, 28% of pregnant women in their first trimester were found to be anemic. Anemia was found to be caused by the following deficiencies: zinc, B12, folate, and iron. A study in Nepal set out to find the socioeconomic factors most closely related to anemia. The following were risk factors: history of complication during previous pregnancy, low knowledge about the condition, low BMI, the age at marriage, socioeconomic status, and smoking. In India, 58.3% of pregnant women are found to be anemic. Of the anemic women, 31% were illiterate, 38% were from the upper middle class. Some socioeconomic factors significantly associated with anemia in this study were level of education, occupation, and consumption of iron and folic acid. In Ethiopia, a study found the following items were associated with anemia: low income, large family size, hookworm infection, and HIV infection were all common associations. Finally, in Nigeria, a study found a 30% prevalence rate of anemia in pregnant women. There are advocations for a higher level of education and economic empowerment. Overall, the prevalence is extremely high in these countries. Socioeconomic factors tend to be common, and they play a huge part in the quality of diet and maternal anemia during pregnancy. There are many next steps that should be taken to improve this disparity. These could include culturally appropriate interventions, reaching women before childbearing age, and focusing on food instead of supplements. Thank you for taking the time to listen to this video.